My name's Dr Nicola Green. I'm a consultant clinical psychologist and I currently work in the CAMHS inpatient service at Inspire.
Hi, I'm Dr Louise Murthorpe. I'm the lead psychologist for CAMHS across Hull and East Riding.
Hi, I'm Emma Sullivan and I'm the early intervention lead for CAMHS across Hull and East Riding.
Oh gosh, well I guess we're a new team at Inspire. We opened in January. The thing that I really enjoy is the dynamic nature of the work. It's really kind of busy and full on, and I really enjoy working with young people and families and just finding out about people's lives. So that would be my kind of favourite things.
I think for me it's about trying to improve the service in terms of children, young people and families. So working closely with other agencies, with commissioners, and really just trying to think about how we can get more services for young people and how we work together.
So my favourite job, a part of my job, is obviously working out in schools and communities, and working from an early intervention perspective to try and work with young people and families to prevent the need from escalating. So really getting in there early and offering that support out within schools.
Oh gosh, I think every day there are new surprises, I would say. When you work with people, you can't really predict. Every day is different. So I think that's partly what I enjoy about my job, and just really the strength of people and families and how they support each other to kind of move on. And I guess the part of the service that I work in, we are seeing people at their most kind of vulnerable and really struggling with their mental health. To obviously require an inpatient admission. So I guess I never cease to be surprised by the strength of people and how much they can cope with, and hope that our support helps them to move on.
I think for me, I mean, when I started working, which was a long time ago now, what surprised me was, I think sometimes people's expectations of what we were going to be able to do. So sometimes there was a real sense that we might have a magic wand and be able to make everything okay. And I think as a newly qualified psychologist, that was quite hard at times because I didn't have a magic wand. So I think over the years, what's been really helpful is how we work collaboratively with families, with agencies, and really think about how we can all support one another and come up with ways of helping, that it's not all down to one person to make everything okay.
I would definitely echo both what Nicola and Louise has said. I think for me, I never ever cease to be amazed by the ability that children and families have, and even in some of their kind of most darkest moments, they still show that strength to kind of become resilient with the right support around them. I think most definitely there's been a huge shift of how we're all really working collaboratively as a whole system to really try and improve young people's and their families' lives. And I think for me it's the ability that young people have to guide us as well, to help us co-produce the services and deliver services that really meets their needs. They're pretty amazing young people.
I would say as long as you have a love of people and kind of finding out, and an inquisitive nature, I think you would really enjoy working in mental health, and just a desire to help and be alongside people and their journeys really. I know journey is a bit of a cheesy term, but it really is often. We get to know, and we're privileged to be welcomed into families' lives for a significant amount of time. So I think it's just kind of being interested and willing to get alongside people. That would be my advice.
Great. I think for me, work-life balance, because it's hard at times. And I think sometimes, you know, if you've had a very busy day, a long day, sometimes listening to people's distress. So really important thinking about self-care. And thinking about ways to kind of manage and support yourself and people you work with, because I think working with children, it's a team. It's not just one person. You don't come to work and work by yourself. You work with lots of other people. So I think a key bit is the team around you, and also how you kind of support yourself.
I think my kind of bit of advice would be to be very open-minded, to be open to new ways of working, really want to make a difference, and be passionate about emotional and mental health, and obviously making a difference to young people, families, and the world in general, really. I think, yeah, very much it's about ensuring that you do take care of yourself and you understand yourself in a really well way, in a positive way, to then be able to empower others to understand themselves.
Well, I like to run. I think exercise is a massive part of how I keep myself well. I think it's a really positive way of kind of keeping emotionally well. I think just the general things around making sure I get good sleep and keeping a good diet, not always that easy to do, but I know it works. So when I am kind of doing that, I certainly feel better in myself. And I think the other thing is just being connected, and social connection is really important. I think particularly in recent times with lockdown and COVID, that's been much harder. And I think we've seen the impact, I guess Louise and I will probably agree, we've seen the impact not only on the families we work with, but also the staff and ourselves. So I think it's really highlighted for me the importance of maintaining social connection, even kind of by electronic means. But those are the things that I value.
I think for me, I really like yoga, and I find yoga a really helpful way of just relaxing, very calming. I think it helps me feel a real sense of connection with my body, because I think sometimes a lot of what we do is in our heads. And chocolate. So I tend to have which is probably not great, but I'll have a piece of chocolate most days, and that just helps me look forward to something. And just like Nicola, I think being around people, and that in COVID times sometimes isn't possible face to face, but just being able to text a friend or speak to someone on the phone or Zoom can just really help if you're feeling it's been quite intense.
I think for me, some of the things that I really value is kindness, being kind to yourself and being kind to others around you. Do like exercise as well, absolutely love walking and getting the dog out for walks, but I'm a really, really big fan of music also, and I find music can often make sense of things for me, particularly if I'm in a place of where the world might not seem like it's making sense. I do find that kind of focus of maybe thinking a little bit differently through the means of music. So yeah, a little bit of everything really, but most definitely about being kind to yourself and kind of knowing when you need to have a bit of a break as well. That's great.
Hi, I'm Debbie. I've worked in mental health since 1987, so 33 years. Initially I worked in adult services, and in the last 18 years I've specialised in older people services, and I've been fortunate that I've been involved in 2 pilot projects over the last 4 years, specifically working with people with complex needs and dementia.
Hello, I'm Dan. I'm a clinical psychologist. I work in adult mental health. I work 4 days a week in the new homeless service, and I work 1 day a week in inpatient mental health. I've been working with mental health for the last 10 years, as a psychologist for the last 3 years, and before that as a support worker and as a healthcare assistant.
Hi, my name's Jodie. I'm a counselling psychologist, and currently I work for a new service called STARS, which is the Specialist Treatment and Recovery Service. So we'll be working mainly in the community with people that may have been in mental health services for quite a while, and trying to help support them in the community and to connect with people. I've worked for the NHS since 2004. And starting as a healthcare assistant, working in primary care, prisons, and then eventually working here in Humber in the recovery sector.
For me currently it's working with families. I think it's almost like being a detective sometimes in trying to understand why people present like they do when they've got dementia. And I think being able to share my knowledge with care home staff, we work a lot with care homes, so sharing what I know with them is really important.
There's two bits that I really love about my job. The first is working with my service users, working with people that I'm trying to support. There's no better feeling than making a connection with somebody who's come to you for help, helping them understand the nature of their mental health problem, helping them understand what's maintaining it, and offering them a little bit of hope for how they might be able to manage it and to recover. And I also really love working with my colleagues. I really love going out and doing joint work with people, and I really love going around and spreading the word about psychology.
My favourite part of my job, and there are many, but I must say the thing that I really enjoy is trying to create an environment where as many people can have a voice as much as possible. So we like to have in our meetings and when we work with our service users and families, we want to hear from everybody, get everybody involved, and it creates a really interesting and really useful way of working, I found, where somebody will come in with an idea that you've just never heard of or an angle that you've never heard of, and that's what makes me happy in work, really.
I was still quite young when I first came into mental health, and I'd never seen anything like it before. Obviously, it was going back quite a few years, but people's fragility and vulnerability, and actually how many people it affects from all walks of life, it knows no bounds, and I knew at that point this job was for me.
I think I was quite surprised at how easy it is to make a difference for somebody. I remember working in Brighton, my first shift as a healthcare assistant, a nursing assistant on a psychiatric ward. And I seem to remember going in feeling kind of quite terrified about what I would see. But actually, that was the point that I knew that this was the job for me. And I remember sitting on the floor talking to distressed people, and just how much of a difference you can make just by listening and being present for somebody.
I think the thing that surprised me the most really was something I'd learned at university, was around what people tend to rate as being most important to them is having a connection and having someone to listen to. But at the same time, I was in education learning about lots of good techniques and things that you could do. And it really surprised me how right that was, that actually people tend to come and they want to be heard, they want to be able to tell their story, and to feel quite relaxed and that it's okay. But I've always tried to remember to hold that first, and that's actually one of the hardest things to do, but one of the most simple things that people tend to need.
I've recently started yoga again. I think we all have to find something that we like, and certainly outdoors, long walks on the moors with no phone and no social media. Escape from it.
Yeah, similarly, I love the outdoors, so I run and walk. I've got lots of nice routes across Beverley Westwood that I like to go on, walking in Yorkshire and the peaks, and I like paddleboarding as well, so there's nothing more relaxing than putting my board on the river hull and paddling up and down a bit.
It's been a bit different recently with COVID, and that's sort of led for me to really think about how much connecting with people is really important for my mental well-being and to de-stress. So I've been just trying to sort of connect with people quite a lot in these times, whether that has been using FaceTime to family, seeing people where you can and how you can. But yeah, just that helps me to de-stress, really, to connect with other people that I care about, whether that's people or animals. Sometimes pets can be quite good at this time too. But yeah, that helps me.
So yeah, I've got two books. Firstly, one by Dr. Wendy Mitchell, who is a lady with Alzheimer's disease. Early onset, was diagnosed in her 50s. She's absolutely amazing, remarkable, an ambassador for the Alzheimer's Society. So I recommend her book to anybody, especially those people that have come into contact with anybody with dementia. It just gives you that insight. I mean, I've worked with people with dementia for years, but it really gave me, an opening. And I've been lucky enough to actually interview Wendy myself, particularly in relation to talking about end-of-life planning, which is a bit of a taboo subject for lots of people, and I think she's been a forerunner in promoting that. The second book is Mindfulness with Mark Williams and Danny Penniman, and that was recommended to me personally, and I opened this book up and started reading and I thought, wow, I get it. So from there, I just wanted to talk about my mental health and how some of it's affected me. And I really questioned disclosing this during this question and answer session. But then I actually felt annoyed with myself. Why wouldn't I? Why am I hiding that? Because I'm a mental health nurse and we don't talk about things like this. I might be seen as inadequate. And also because of shame, embarrassment and society's perception that I'm weak and will be judged. I have felt these things in the past and I'm clearly still hanging on to some of the clearly untrue assumptions. I've not disclosed this to heal myself, but to stand up and say this is me. I have experienced symptoms of mental health during periods of my life. And you know what? As hard as it was, I conclude that I'm a strong person, because to live with that and carry on, you have to be resilient. And one of the most important things is accept it. It's going to take some real effort to deal with the debilitating symptoms. But I also know that black days become grey and the clear days will return. No one should hide how they feel. We don't hide other conditions that affect our physical self. Mental health needs are just as relevant, if not more so. We can see a broken leg, but we can't see mental and emotional pain. I've experienced anxiety and depression problems over the last 25 years. On a couple of occasions it has taken me away from work. Many people I know and work with would never know that I've experienced this. So I am a nurse, but we know mental health conditions know no bounds, and of course there are many levels of severity. But the most significant point I want to make is we will never truly know what someone is dealing with when they're hiding their inner turmoil because of the shame and judgment they feel they will perceive, and also that no one else will be able to help or understand. Mental health is within us all. It can be hard to see and hear because it's often seen and unheard until it's too late. Never hide your symptoms and always be aware of those around you who might be hiding theirs.